This is the NOVA study. This was a several hundred patient trial of women with relapsed platinum-sensitive high-grade ovarian cancer who were platinum sensitive but also responding to platinum, so in receipt of platinum and benefiting from platinum, and then went on either Niraparib 300 milligrams once a day versus placebo. So this was a double-blinded placebo study, randomized, a worldwide trial. And how patients came in was that, again, platinum sensitive, responding to platinum, and then they underwent germline BRCA testing. So they underwent BRCA testing. And then they were grouped into two other groups. So then they went into a germline BRCA group or a non-BRCA group. So gBRCA, non-gBRCA. And in the gBRCA group, they were further than, but retrospectively so, tested for something called homologous recombination deficiency, or HRD. And the groups, the pre-identified groups, were gBRCA versus non-gBRCA, and then HRD positive, non-HRD positive, and then the negative group. So in all those groups, you had Niraparib versus placebo. And in all the groups, there was benefit to receiving the PARP inhibitor Niraparib. So it didn't matter if you, certainly the women who have an underlying BRCA mutation within their cancer benefited. The women who had cancers that were HRD positive benefited from Niraparib. But also the patients who had tumors that were non-BRCA, non-HRD also benefited from Niraparib. And I think this is not a surprising result because you've really distilled all the patients with epithelial ovarian cancer into the group that's going to benefit most from a PARP inhibitor, because you've got platinum sensitive, initially still responding to platinum, so continued platinum sensitive patients, and histology was also really in favor of the group being responsive to a PARP inhibitor. High-grade serous, high-grade endometrioid cancers were also, it was eligibility criteria to be enrolled into the trial. So I think this is very exciting. It really represents the first time for a phase 3 study to show such benefit. Really, it is the first phase 3 trial to be reported of a PARP inhibitor, and showing really quite significant progression-free survival benefit.